Hello friends, welcome to my channel. Today I'll see about the previous nursing competitive exam question papers. It will be helpful for you. So what type of questions they will ask in competition exams for government jobs anywhere, any areas. I hope it will be helpful for you. So please follow this. In this video, first we will see about that GMCH Chandigarh staff nurse exams for the year of 2019. So in this multiple choice questions for nursing competition exam, I had prepared video 1. So for this question paper, there are having 4 videos. So this is the first video. In this chapter, I had given 25 questions. Total examination pattern is 100 questions. So for each video, I had shared 25 questions. The first question is, a positive over-the-counter pregnancy test is considered A. Possible sign of pregnancy. B. Presumptive sign of pregnancy. C. Probable sign of pregnancy. D. Positive sign of pregnancy. The answer is C. That is, probable sign of pregnancy is a positive over-the-counter pregnancy test. Second question is, you are working in a pediatric unit of the hospital and caring for a 6-year-old boy who is hospitalized with cystic fibrosis and respiratory compromise. Which developmental task is the challenge for this boy at this age? A. To cough, deep breathe and improve respiratory status. B. To establish industry and self-confidence. C. To develop autonomy and self-control. D. To develop initiative and a sense of purpose. The answer is D. To develop initiative and a sense of purpose. Next one is, during which week does the fetal heart begin pumping its own blood? Third week, fourth week, fifth week, sixth week. The answer is A. Third week. During the third week of pregnancy only, the fetus can start that own pumping of blood. Fourth question, which type of cancer has the poorest prognosis? Squamous cell carcinoma, breast cancer, pancreatic cancer, gastric cancer. Answer is C. That is pancreatic cancer. The stages of infection in correct sequential order are A. The prodromal, incubation, illness and convalescence stage. B. The incubation, prodromal, illness and convalescence stage. C. The prodromal, primary infection, secondary infection and tertiary infection. D. The inflammation, infection and disease. Answer is A. The prodromal, incubation, illness and convalescence stage are sequential order for stages of infection. Match the list with list 2. Here 1 and 2 list is there and give your answer using the codes given below. The list 1, P, the acetylcholinergic system, Q, the noradrenergic system, R, the serotonergic system, S, the hyposerotonergic system. Under list 2, raffinuclei, lateral hypothalamus, pons and basal forebrain and locus coeruleus. Here the answer is D. Means here the 3, 4, 1, 2 is the answer. Which of the following is the best method to relieve constipation during pregnancy? A. Lying flat on back while sleeping. Increasing the intake of vegetables and fruits. Reduction iron take. And taking a mild over-the-counter laxative. Answer is B. Increasing the intake of vegetables and fruits. Next, of the following, which disease causes most death worldwide? Cardiovascular disease, HIV or AIDS, malaria or infected person. Answer is A. Cardiovascular disease. Which of the following is a vector of infection? A. Infectious fly. B. A contaminated thermometer. C. A contaminated bowl. D. An infected person. Answer is A. An infectious fly. 10th question. An infant born with non-communicating hydrocephalus has just had a ventroperitoneal shunt inserted. In addition to neuromuscular assessments, what measures should the nurse use in child's care plan? A. Reinforce wet dressings every second hourly. B. Position the infant on operative side. C. Place an infant in semi-folds position. D. Measure head and abdominal circumference. The answer is D. Measure head and abdominal circumference. 11th one is, what is the term used for normal respiratory rhythm and depth in a client? A. Apnea. B. Apnea. C. Bradyapnea. D. Tachyapnea. Answer is A. Apnea. Alarm, resistance and exertion are concepts related to health belief model or trans-theoretical model or health promotion model or general adaptation syndrome. The answer is general adaptation syndrome. A client is in the late active phase of labor. Suddenly she tells the nurse she feels weak and dizzy. The nurse notes the drop in maternal BP and late decelerations of fetal heart rate. The initial action the nurse should be to do: increase the IV drip rate and notify the provider. B. Turn the client on side and administer oxygen. C. Assess for cord prolapse or vaginal bleeding. D. Prepare for immediate delivery. The answer is B. Turn the client on side and administer oxygen. Next, during which war did the United States ask for Florence Nightingale's assistance in setting up military hospitals? Crimean War, World War I, World War II, Civil War. Answer is D. Civil War. And the 15th question is, birth rate is live birth per 1000 mid-year population. B. Birth per 1000 mid-year population. C. Live birth per 10,000 mid-year population. D. Live birth per 10,000 population of reproductive age group, that is 15 to 45. Answer is A. Live birth per 1000 mid-year population. Next one, as per latest census sex ratio, that is the number of females per 1000 of males of Chandigarh is reported to be A. 718, 818, 918, 1000. The answer is B. 818. This step of the nursing process includes the systematic collection of all subjective and objective data about the client, in which the nurse focuses holistically on the client, physical, psychological, emotional, socio-cultural and spiritual aspect. That is assessment, planning, implementation and diagnosis. Answer is A. Assessment. 18. There are a number of risk factors associated with coronary artery disease. Which of the following is a modifiable risk factor? A. Obesity. Hereditary. B. C. Gender. D. Age. Answer is A. Obesity. When administering single rescue adult CPR, what is breaths to compression ratio? 2 breaths every 30 minutes, 1 breath every 30 compressions, 1 breath every 15 compressions, 2 breaths every 5 compressions. Answer is 2 breaths every 30 minutes. Rashtriya Bal Swastha Karyakramam is a new initiative aiming at early identification and early intervention for children from birth to 18 years to cover 4 diseases. What are those? The answer is defects at birth, deficiencies, diseases, development delays including disability. Next, arrange the following 5 events in correct order of occurrence. 1. Stimulation of anterior pituitary. 2. Stimulation of ovaries. Stimulation of neurosecretory cells. Release of gonadotrophic hormone and release of gonadotrophic releasing hormone. Here the answer is A. That is, the sequential order is, first one is stimulation of neurosecretory cells leads to release of gonadotrophic releasing hormone. It leads to stimulation of anterior pituitary and it leads to release of gonadotrophic hormone. Finally, it leads to stimulation of ovaries. That is the sequential order. Then arrange the following events in the order of their occurrence in panic circle. Here they had given the steps: apprehension on worry, body sensations, perceived threat, Interpretation of sensations as catastrophic. Trigger stimulus. Answer is C here. The steps are, first one is stimulus means a trigger stimulus will be there. Then it leads to third step, perceived threat, leads to apprehension, worry, leads to body sensation, and finally leads to interpretation and sensations as catastrophic. While receiving blood transfusion, the patient develops chills and headache. What should be the nurse's initial action? Notify the physician, stop the transfusion immediately, cover the patient with a blanket and administered order acetaminophen, slow the blood flow to keep the vein open. Answer is B, stop the transfusion immediately. Choose the most therapeutic response to Mr. Shyam's question, am I going to die? One is, we all are going to die one day. What has your doctor told you? You really do not want to talk about death, do you? Would you like to talk about your condition and prognosis? Answer is, would you like to talk about your condition and prognosis? Next one, which of the following would be a common indication of infiltration of a peripheral intravenous infusion? Redness and swelling around the insertion site, blood return in the cannula, difficulty regulating the flow with gravity, cool skin distal to the insertion site. Answer is A, redness and swelling around the insertion site. Thank you. This is the first video. I had prepared 25 questions. Next video I will prepare with explanation of the each question and all. Thank you and all the best.